if you're going to submit these CPT codes that represent the performance of remote monitoring of physiologic parameters, the first thing to consider is, which device am I going to use? Which device am I going to pick that's going to provide the feedback that I'm going to monitor? There are lots of options. Dr. Yeager and I use the example of the smart insoles as an option. There are other options for you to consider. We had a short period of time, we picked one as an example. When you choose that device, which is going to provide the physiologic parameter that you're going to monitor, there are a couple boxes that need to be checked. The first is it actually measuring a physiologic parameter? We all know the definition of physiology. Is it physiologic parameters that are being sent back? We use the example of the smart insoles that are giving us pressure, temperature, activity, steps, adherence, utilization. Obviously meeting the definition of physiologic parameters. And I'm making this point because this is a good deal, and I've been asked some silly questions like, and I know this is absurd, and I hope most of you roll your eyes when I say this, but like, if I get a pedometer out of a cereal box and the patient shows me how many steps they took, does that count? No, that doesn't count, right? It's got to be true physiologic parameters by the definition of physiology. The other thing to consider is, in doing what I do, I get the opportunity to communicate with medical directors at these third-party payers quite a bit, and it is clear that if they are going to recognize our submission of CPT codes that represent our monitoring of physiologic parameters, they want the device that's providing the feedback to itself be a covered device and to have a code. I'm going to repeat that because I feel like it was a really long sentence. If they're going to cover the CPT codes for our monitoring of feedback, they want the device that's providing the feedback to be covered and to have HCPCS coding. And in my silly example, the pedometer that's coming out of the cereal box, that's not covered. There's no code for that, right? And you will find other examples out there as you consider your options that also are not covered and don't have HCPCS coding. And I'd suggest that that should play a role in your selection of what device you're going to use to provide this type of feedback. These medical directors, and this is true of almost any service we provide, they want it to be medically necessary. They want there to be peer-reviewed, published literature that supports our provision of this service. Dr. Yeager shared with us the randomized controlled trial that shows this prevents ulcers and saves money. That's the type of data they're talking about. They want randomized controlled trials to support what we're doing. That can be said really of any service, most services that we provide. And lastly, the device that we choose should meet the FDA definition of a medical device. And this last one, this isn't even a payer thing. This comes from CPT. This is straight out of the CPT book. This was in the 2020 book, and it's in the 2021 book, that if we're going to submit these CPT codes for remote monitoring, the codes I'm about to go through with you, the device that's providing the feedback that we're monitoring should be a medical device, meeting the FDA's definition of a medical device. That is a thing where the FDA defines what a medical device is. What we're using to provide the feedback should be a medical device.